The role of nurses who care for you may be expanded in Ontario as the Ford government tries to ease the pressure on hospitals. Changing the definition of what they do is in Bill 60, potentially changing it. That's the bill that will allow more surgeries in private clinics. It is called Your Health Act, or Bill 60. If passed, which it will because the PCs have a strong majority, healthcare professionals will be able to work outside of their regular responsibilities. In the case of nurses, that means they could take on more. The government confirms they're looking at expanding their roles so nurse practitioners can order and apply defibrillation, ECGs, and certify death. Registered nurses can prescribe medication, and registered practical nurses could potentially be able to independently do wound care. That last part has the Ontario Nurses Association alarmed.
Potential risks there for these controlled acts is really significant.
The ONA argues registered practical nurses don't have the training to do wound care.
Have you made your position known to this government?
Yes, the position statement was submitted to the government.
And what kind of response have you received?
At this point, we have not received any kind of response.
A senior Ford government staffer told CityNews that if nurses could do more, in theory, a patient could get in and out of hospital faster, freeing up more capacity. However, the union says the shortage of nurses is the bigger issue.
We need more nurses, and we need to retain the ones that we have.
Just yesterday, the province's financial watchdog raised the alarm over the shortage of frontline healthcare workers, predicting Ontario could be short 33,000 nurses and PSWs in 5 years. The government is trying to alleviate that in part of Bill 60, which allows trained healthcare professionals in other provinces to work in Ontario while they wait for registration approval.
But the most important thing is if people who are practicing as clinicians in all of Canada want to come to Ontario, you are not going to be delayed in starting that work.
The NDP say Bill 60 is complex and makes a lot of changes to the rules within healthcare, and the government needs to be more transparent about it. The bill will have a week of public hearings in March and is expected to pass in April. On to other provincial business now. The Ontario government says it's banning the social media app TikTok on government-owned devices and on the personal devices of progressive Conservative MPPs. Ontario joins the federal government and all other provincial governments in blocking the app. It comes after a review by Canada's Chief Information Officer. China has a stake in TikTok's owner, ByteDance, and Chinese laws allow the country to demand access to user data. TikTok maintains that it does not share data with the Chinese government, and its data is not held in that country.